I see people get excited when we talk about butorphanol. There's some people who hate it, and there's other people who are still using it a lot. How do you see this being used today in practice?
I don't like the blanket statement, oh, butorphanol is worthless. I don't think that's true.
Yeah.
But I do think we need to be careful about how and when we're utilizing it. There's different types of receptors within our nervous system that respond to opioids. Butorphanol works a little bit different in that it's actually an agonist, antagonist opioids, which means it goes over to the kappa receptor and it stimulates that. And it goes over to the mu receptor and it blocks it. So why would we need kappa receptor activation? The kappa receptor is actually responsible for some mild visceral analgesia, important when we have a patient that we might be like going in and our surgeons are in there touching and feeling and pulling on all those guts and initiating some visceral pain. But also the kappa receptor is really responsible for sedation. And that is where butorphanol is going to shine. So if I have a patient that we don't necessarily need to do something super painful, however, this patient is a brachycephalic and they're really freaking out and I have to put them on their back for an ultrasound, butorphanol is probably going to shine here. Let's say I have a patient that maybe has some pancreatitis. Kappa receptor needs to be activated. So what's going to do that? That's going to be our butorphanol.